What if one spoonful of a kitchen liquid could change the way your body burns fat, controls sugar, and feels energy every single day for just 14 days? Stay with me, because what happened to thousands of people who tried this, including patients in my own practice, might surprise you more than any pill or supplement ever could. Hello everyone, and welcome back to the channel. I am Dr. Watsun, and today we are going to talk about something that sits quietly in almost every kitchen, yet very few people understand its true power: apple cider vinegar. For years, this simple, amber-colored liquid has been whispered about in health circles, praised by grandmothers, recommended by naturopaths, and now backed more and more by modern research. But what actually happens inside your body when you drink apple cider vinegar consistently, every day, for 14 days straight? Today, we are going to walk through that journey together, day by day, system by system, so that by the end of this video, you will know exactly what to expect, what to watch for, and whether this ancient remedy deserves a place in your daily routine. Before we go further, let me be clear about something. This video is for education only. It is not medical advice. And if you are on any medication, especially for diabetes, blood pressure, or if you have any kidney or digestive condition, please speak with your doctor before starting anything new, including apple cider vinegar. Now, with that said, let us begin. Apple cider vinegar, often shortened to ACV, is made through a two-step fermentation process. First, crushed apples are exposed to yeast, which turns their natural sugar into alcohol. Then, bacteria are introduced, which convert that alcohol into acetic acid, the primary active compound responsible for most of vinegar's reported effects. This acetic acid is what gives apple cider vinegar its sharp, sour smell, and it is also believed to be the main reason behind many of the changes people report in their bodies. Let us talk about day 1 and day 2 first. When you take your first tablespoon of apple cider vinegar, diluted properly in a large glass of water, many people report an immediate, sharp sensation, almost like a wake-up call for the digestive system. Some feel a warming sensation in the stomach, others notice a slight increase in saliva production, which is actually your body preparing to break down food more efficiently. During these first 2 days, the acetic acid begins interacting with the stomach lining, and for some people, this can mean improved digestion of heavier meals, while for others, especially those with sensitive stomachs, it can mean mild discomfort. This is completely normal, and this is exactly why starting with a small diluted amount, rather than drinking it straight, is so important. By day 3 and 4, something interesting starts to happen with blood sugar regulation. Several studies have suggested that acetic acid may slow the rate at which starches are broken down into sugar in the bloodstream. This means that after a carbohydrate-heavy meal, some people who take apple cider vinegar experience a smaller, more gradual rise in blood sugar rather than a sharp spike followed by a crash. For our older viewers, especially those managing prediabetes or watching their blood sugar closely, this is often the single most talked about benefit. However, and this is very important, if you are on insulin or any blood sugar lowering medication, this effect can compound with your medication and cause your blood sugar to drop too low. So this is a conversation you must have with your physician first. Moving into day 5 and 6, many people begin to notice changes in appetite. Acetic acid has been linked, in some research, to increased feelings of fullness after meals. Scientists believe this may be related to a delay in stomach emptying, meaning food stays in the stomach a little longer, sending fullness signals to the brain for an extended period. This is one of the reasons apple cider vinegar became so popular in weight management circles. People taking it before meals often report eating smaller portions naturally, not because they are forcing themselves, but because they simply feel satisfied sooner. Now, I want to pause here and remind you, this is a subtle effect, not a dramatic one. Apple cider vinegar is not a magic weight loss potion. And anyone promising you rapid fat loss from vinegar alone is not being honest with you. Now, before we continue into the second week, I want to ask you for something small but meaningful. If you are finding this information helpful, please take a moment right now to hit that subscribe button and tap the notification bell beside it. Every single week, I bring you carefully researched, easy to understand health information made especially for you and your family, and your subscription helps this channel continue reaching more people just like you, who deserve clear answers without the confusion. It costs nothing, it takes 2 seconds, and it means the world to this channel. Now, let us continue. By day 7, we reach the halfway point, and this is often when people start noticing changes in their skin and energy levels. Some report their skin appears slightly clearer, and this may be tied to improved gut health, since a portion of our skin's condition is influenced by the balance of bacteria living in our digestive tract. Apple cider vinegar contains what is called the mother, a cloudy web-like substance made of beneficial bacteria, yeast, and proteins, which some believe supports a healthier gut microbiome. A healthier gut can sometimes translate into reduced bloating, more regular digestion, and yes, occasionally, calmer-looking skin. However, I do want to be honest with you. The research connecting vinegar directly to skin appearance is still limited, and much of this evidence remains anecdotal rather than clinically proven. Day 8 and 9 often bring reports of improved energy throughout the afternoon. This may be linked to more stable blood sugar levels, since dramatic spikes and crashes in blood sugar are one of the most common causes of that heavy, sleepy feeling many of us experience after lunch. When blood sugar rises and falls more gently, energy tends to follow the same gentle curve, rather than a sharp rise followed by an exhausting crash. For many of our senior viewers, this steady energy can make a real difference in daily activities, whether that is gardening, spending time with grandchildren, or simply feeling more alert during the day. As we move into day 10 and 11, cholesterol and heart health often come into the conversation. Some animal studies and a smaller number of human studies have suggested that acetic acid may help reduce triglycerides and LDL cholesterol, often referred to as the harmful cholesterol, while potentially supporting healthy HDL, the beneficial cholesterol. The proposed mechanism involves acetic acid's influence on how the liver processes fats. Now, I want to be very careful here, because this is an area where enthusiasm often runs ahead of the evidence. While early results are promising, apple cider vinegar should never replace prescribed cholesterol medication, and it should be viewed as a possible supportive habit, not a replacement therapy. By day 12, many people report noticing changes in bloating and water retention. Some researchers believe apple cider vinegar may have a mild diuretic-like effect for certain individuals, meaning the body may release slightly more water weight. This is often mistaken for fat loss, when in reality it is simply a shift in water balance. It is a small distinction, but an important one, because understanding what your body is actually doing helps you set realistic expectations rather than chasing numbers on a scale that do not reflect true, lasting change. Day 13 tends to bring a noticeable shift in how people relate to their food choices. After nearly 2 weeks of a consistent routine, many people report they naturally begin reaching for less processed food and more whole foods, vegetables, and lean proteins. This is less about the vinegar itself and more about the psychological effect of building a health-conscious ritual into your day. When you commit to one healthy habit, it often creates a ripple effect, encouraging other positive choices throughout your daily routine. Finally, we arrive at day 14, the conclusion of this 2-week journey. By this point, many people report a combination of the following: more stable energy throughout the day, reduced bloating, a gentler response to carbohydrate-heavy meals, a slightly improved sense of fullness after eating, and for some, modest support for healthy cholesterol levels. It is important to understand that these results vary significantly from person to person, based on diet, activity level, existing health conditions, and overall lifestyle. Apple cider vinegar is not a cure. It is not a replacement for medication. and it is certainly not a substitute for a balanced diet and regular movement. Instead, think of it as a small, supportive habit, one piece of a much larger picture of health. Now, let us talk about how to actually do this safely, because this matters more than almost anything else in this video. Always dilute 1 to 2 tablespoons of apple cider vinegar in a large glass of water. Never drink it undiluted, as the acidity can damage tooth enamel over time and irritate the lining of the throat and esophagus. It is often best taken before meals. Using a straw can help protect your teeth from direct contact with the acid. And rinsing your mouth with plain water afterward is a smart, simple habit. If you notice any burning sensation, worsening acid reflux, or stomach discomfort, stop immediately and consult your doctor. Individuals with ulcers, severe acid reflux, or certain kidney conditions should avoid apple cider vinegar altogether unless specifically cleared by their physician. I also want to address something many people ask me directly. Can apple cider vinegar interact with medications? The honest answer is yes, it can. Because of its effect on blood sugar, it may interact with insulin and other diabetes medications. Because of its potential mild effect on potassium levels, it may also interact with certain diuretics and heart medications. This is exactly why I keep repeating throughout this video, please speak with your doctor or pharmacist before adding apple cider vinegar to your daily routine, especially if you are over 60 or managing any chronic condition. Your safety always comes first. Always. Let me also address a myth that circulates constantly online. The idea that apple cider vinegar can dissolve fat directly or detoxify your entire body overnight. This is simply not accurate. Your liver and kidneys are already remarkably efficient at detoxifying your body. Apple cider vinegar does not replace or dramatically enhance this natural process. What it may do, in a much more modest and realistic way, is support digestion, gently influence blood sugar response, and encourage a feeling of fullness. Nothing more dramatic than that, and frankly, nothing less valuable either. Sustainable health comes from small, honest habits practiced consistently, not from miracle claims. So, should you try the 14-day apple cider vinegar routine? If you are generally healthy, not on medications that could interact poorly, and you approach it with realistic expectations, it can be a low-cost, low-risk addition to your daily routine. One that many people find genuinely helpful for digestion and steady energy. But if you have any underlying health condition, any doubt at all, please talk to your doctor first. This single conversation could save you from unnecessary complications, and it takes only a few minutes of your time. Before we close out today's video, I want to thank you sincerely for spending this time with me. If this information helped clarify something for you, or if you learned even one new thing today, please subscribe to this channel right now, hit that bell icon so you never miss a new video, and leave a comment below telling me whether you plan to try this 14-day routine yourself. Your comments genuinely help me choose which topics to cover next, and I read every single one. Share this video with a family member or friend who might benefit from this information, because health knowledge shared is health protected for everyone we love. Remember, everything discussed in this video is intended for general educational purposes only and should never replace personalized medical advice from your doctor or healthcare provider. Every body is different, every medical history is different, and what works safely for one person may not be appropriate for another. Always consult your physician before making any changes to your diet, supplements, or medication routine, especially if you are managing a chronic condition. Thank you again for watching. I am Dr. Watsun, and I will see you in the next video. Take care of yourselves and take care of each other.